Hi everyone. Precision medicine is a trending term in science now, dealing with the discovery and delivery of tailored therapies for patients depending on the patient's genetic signature. So this emerging field focuses on which medical practice, which strategy is the most convenient, the most effective for the patient, depending on a number of factors, genetic as well as environmental, in addition to the patient lifestyle. So this field is challenging, as very interesting, and promises many opportunities for young scientists to make great discoveries that will be translated into naturally good actions to serve the society. And because of that, many universities around the world have designed master programs on precision medicine to train professionals from different, in fact, disciplines to join this magnificent journey that, in fact, will change the medical practice forever. So today I will make a presentation, provide an overview of precision medicine to focus on some of the challenges, the scope, and I will equally provide an example showing the successful approach of precision medicine. First of all, I am Professor Fad Nasr from the Lebanese universities in Beirut, and here you have the private website. You are all invited to visit. And to start this, in fact, presentation, I would like to quote from Hippocrates, who, in fact, wrote, "It's more important to know what sort of person has a disease than to know what sort of disease a person has." So this is, in fact, what precision medicine is all about, is an emerging, in fact, a global approach to deliver tailored therapies. The purpose is to treat and prevent diseases, and this is based on the patient's genetic makeup, environmental factors, and, as I mentioned, the patient lifestyle, which means that two individuals having the same disease should receive different treatment. Let me have the laser first. So we have two terms that are widely used. We call personalized versus precision medicine. In fact, the two terms have been used interchangeably. For personalized medicine, it's about providing the right treatment to the right patient at the right dose at the right time. So maybe precision medicine is quite wider in that sense. It's about diagnostic and therapeutic strategies to target a patient subpopulations with susceptibility to a distinct disease condition, and this is based on genomic profiles, environmental influences, lifestyle habits, and family history. So you can see very well that personalized medicine is another ambitious approach for individualized treatment regimen tailored for the benefit of a single patient. However, in literature, these two terms have been used, as I mentioned, interchangeably. So the challenges of precision medicine are manifold, starting with the gathering, organizing, and analyzing big data. And this requires, in fact, good computer programs. That's why I told you the discipline is involving scientists from different fields. So I will dedicate a different lecture for the precision medicine challenges. I would like to move quickly into the early example of precision medicine. Starting in 1907, Ruben Ottenberg reports the first known blood compatibility test for transfusion using blood typing technique and cross-matching between donors and patient to prevent hemolytic transfusion reaction. This was the first example. The second example dates back to 1956, a case of favism and primaquine having obviously the same genetic basis. The selectivity the selective toxicity of favamines, what we call favism, and the antimalarial drug primaquine, of that, the consequence of having this drug for some persons have the same genetic basis, which is a deficiency in the metabolic enzyme, the glucose 6-phosphate dehydrogenase. As a matter of fact, primaquine should never be administered to anyone having this deficiency, because a severe reaction can occur and the result is a hemolytic anemia. Despite this observation, the World Health Organization has recommended that we can give, in fact, a single dose, low dose of 0.25 milligram per kilo to those individuals having the glucose 6-phosphate dehydrogenase deficiency for the purpose of preventing the transmission of Plasmodium falciparum, which causes malaria. The third example of precision medicine is cytochrome P452D6 in 1977. It was shown that this polymorphic metabolizing enzyme may be the reason why some patients can experience an overdose of debrisoquine, which is a drug used for the treatment of hypertension. In fact, the enzyme is found to amplify the effects of debrisoquine. So these are the first three examples of precision medicine. I would like to move on with an approach that we call one dose fits all approach versus personalized medicine, just to illustrate the difference between the normal, or what we call the classical medical practice, and the new trend of precision medicine. So here you have a representation of the trial and error of one dose fits all approach versus precision medicine. So to the left panel, you can see we have a situation in which everyone gets the same dose of a drug of 100 milligram, regardless of the genotype. While to the right panel, you have the precision medicine approach in which the dose of the drug is selected based on the genotype of the individuals. So the phenotypical variability of the metabolizing enzyme dictates which dose is the most convenient for each person. So you can see, for instance, for the ultra rapid metabolizers, a dose of 500 milligram should be given for the drug to be effective. For the two categories of intermediate and extensive metabolizers, a dose of 100 milligram proves sufficient. And for the poor metabolizer, a low dose of 10 milligram is enough, in fact, to fix the condition. So as you can see very well, giving all individuals 100 milligram would prove ineffective for those ultra metabolizers and might be an overdose for those that we qualify as poor metabolizer. This is the main difference between the classical versus precision medicine as shown on this slide. So as a perspective, if I have to provide a perspective of precision medicine, I would say, starting with the simple phrase, medicine is personal, and we are all different. So we show different responses to drug. That's why it's our right to ask for tailored treatment, a treatment that fits, in fact, each person, because some need twice the standard dose to be effective, or even more or less. Some experience side effect. A drug might work for some, not for all. Some people can get cancer and others don't. So we have here a number of factors that should be taken into consideration for precision medicine. So that is why we have many definitions covering this promising and challenging fields from literature, ranging from the most broad to the very narrow definition. For instance, the use of new methods of molecular analysis to better understand and manage a patient's disease or predisposition to develop a disease. Another definition, it could be about providing the right treatment to the right patient at the right dose at the right time, as we have seen previously with personalized medicine definition. or the tailoring of medical treatment to the individual characteristic of each patient. The healthcare that should be informed by each person's unique clinical, genetic, and environmental information. So you can see very well that we are here with a new trend, with a new direction, a form of medicine that uses information about a person's genes, proteins, and environment to prevent, diagnose, and treat disease. So here we have a figure I found in a publication in 2001 about the percentage of patients for whom drugs are ineffective. So you can see here a list of conditions starting on the top with depression, asthma, cardiac arrhythmia. You have diabetes, migraine, and so on till the end we have cancer. And you can see very well for each, in fact, condition, we have a percentage of patients that do not respond to the drug. We should note that lack of efficacy of a given patient may reflect a complex interaction of factors and can also be the result of inadequate or inappropriate dosing regimens of a drug that would otherwise be effective. But still, the data are clear that many patients do not respond or respond poorly to some diseases. So that is why treatment should be tailored to help those patients. I promise to give an example, a successful story of precision medicine, and this is Herceptin, which is in fact no more than an antibody that was raised against a protein encoded by the HER2 gene. In fact, HER2 gene codes for a cell surface receptor involved in signaling pathway for cell proliferation. So the story of Herceptin, and we call trastuzumab, began with the identification by Robert Weinberg in 1979 of the gene HER2, which obviously is involved in multiple cancer pathway. So it was here an attempt to understand the link between HER2 and specific types of cancer. And investigation led to the discovery that overexpression of HER2 protein is found in approximately 20-25% or even 30% of breast cancer cases. And more than that, it was observed, this overexpression, in a type of the disease we call aggressive form of the breast cancer. So this observation made it clear that HER2 protein overexpression could potentially serve as a marker, both as a marker of aggressive disease as well as a target for treatment. When I say aggressive disease, I mean those cells that are proliferating fast and at the same time having the ability to invade other tissues. So let's say a word about trastuzumab or Herceptin. The two terms are the same. Starting with the, in fact, normal condition. In normal breast tissue cell, the gene HER2, it codes for a cell surface receptor required for normal cell growth. Now, in certain type of breast cancer, the HER2 gene is overexpressed, leading to abundance of this cell surface receptor, which contribute to the cancer cell growth. So this is the case, as I mentioned, of 30% of breast cancer. So the Herceptin has been designed, which is an antibody, as I told you, to block the cell surface receptor, and that way it prevents further growth. So the result, the disease progression would be slower. So on this slide, you can see very well on the left, the HER2 protein forming a dimer, and then it signals tumor cells to proliferate. When you add Herceptin, Herceptin will bind specifically to this HER2 receptor, preventing its dimerization, and at the same time, it will block downstream signaling, which inhibit further proliferation of the cell. And at the same time, it will flag those cells overexpressing HER2 protein and target them to destruction, for destruction by immune system. So the approach is in fact specific. The Herceptin should be given to those HER2 positive breast cancer patient to in fact prevent those cells from proliferating further and invading other tissues. So very well, I would say to continue this successful story. So in May 1998, Herceptin, which obviously is a novel antibody therapy, was found to be highly effective in treating patients with this aggressive and intractable form of breast cancer. This was the first biological therapy, the first gene-based therapy designed to shut off the HER2 gene, making those cells, the cancerous cells, growing slowly and without damage to normal tissue. So you can see here the precision, the accuracy, which means that patients taking the new treatment will suffer fewer severe side effects when compared to other treatment available at that time. Very well, so at the same time, later in September 1998, the FDA agency approved Herceptin for the treatment of HER2 positive metastatic breast cancer. The FDA also granted approval to another company for a test we call HERCEP test, which is an in vitro assay to detect the HER2 protein overexpression in breast cancer cells. This has marked the beginning of a new trend, a new approach, an exciting journey towards the co-development of gene-based therapy, together with tests to detect the drug targets in order to identify the right therapies for the right patient, which means that Herceptin should be given to HER2 positive breast cancer patient, not to all of them. It wouldn't be effective for those HER2 minus, in fact, patient. Even it can cause harm. Moving on, Herceptin today testing is a routine part of clinical diagnosis for breast cancer patient, and testing methods for HER2 have evolved, and the FDA has approved many other tests for HER2 detection. And it's good to mention here that in terms of business, Herceptin has generated more than $5 billion in sales for the companies Genentech, Roche in 2011. In 2012, another drug called Perjeta, having similar HER2 binding mechanism, compared to Herceptin, has been found to improve the outcome when combined with Herceptin, which means that together with Herceptin, the result is further reduction in the growth and survival of HER2 positive breast cancer cell. And this is in fact a way to show that there is possibility to improve the treatment by new molecules having specific properties. And as you can see here, the combination of two antibodies, which are Herceptin and Perjeta, were found to be effective in the treatment of breast cancer patient. Now, the development and approval of Herceptin, as I mentioned, marked the dawn of a new era of cancer treatment. It's a way to bring, in fact, the genetics of cancer out of the laboratory to the patient's bedside, which is one of the purpose of precision medicine, to translate the genetic basis information, the information we get from the bench to the patient's bedside. And the story of Herceptin was very inspiring and emphasized a profound lesson that all cancers are not the same. Even breast cancer cannot be viewed as a single disease, but entails many subtypes, each having distinct molecular signature. So the biological diversity of cancer treatment regimens, as you can here infer, are designed with this understanding of a cancer's underlying biological feature. With this, I have come to the end of this short presentation about precision medicine. I hope it was inspiring for all of you, young scientists searching to embark on an exciting career to make discoveries in the future. So if you like this video, you would like to show support, or you have a question, please leave a comment. And in case you have a proposal for a collaboration, please write me directly using this email. In fact, I have designed an evolving and promising and dynamic, comprehensive master program on precision medicine that is ready to be implemented at any academic institution. So if you are interested for a future potential collaboration, please let me know. Write me directly to my email. Use my email. Thank you for your attention and see you next time. Meanwhile, have a nice time and goodbye.